your host for this video, presented by the Audacia Foundation, funded by the New York State Department of Health managed long-term care workforce investment organization. According to the CDC, all healthcare personnel, or HCP, must adhere to standard and transmission-based precautions for COVID-19. All residents in affected units should be placed on standard, contact, and droplet precautions, regardless of the presence of symptoms and regardless of COVID-19 status. All HCP on affected units should wear gowns, gloves, eye protection such as goggles or a face shield, and N95 respirators or equivalent. Personal protective equipment, or PPE, is defined as specialized clothing or equipment worn by an employee for the protection against infectious materials. HCP must receive training on and demonstrate an understanding of when to use PPE, what PPE is necessary, how to properly don, use, and doff PPE in a manner to prevent self- and cross-contamination, how to properly dispose of or disinfect and maintain PPE, the limitations of PPE. This video will focus on the proper sequence of donning and doffing of PPE from the World Health Organization. Sequence of putting on or donning PPE. Perform hand hygiene. Gown, mask or respirator, goggles or face shield, gloves last. Sequence of removing or doffing of PPE. Gloves first, goggles or face shield, gown, mask or respirator, and perform hand hygiene. Now we will watch the steps and sequence for putting on or donning of PPE. Step 1. Hand hygiene. Step 2. Donning of gown. Select appropriate type and size. Secure at neck and waist. Step 3. Donning an N95 respirator. Place over nose, mouth, and chin. Fit flexible nose piece over bridge. Secure on head with ties or elastic. Adjust to fit. Perform a seal or fit check by inhaling to collapse the respirator and exhaling to check for leakage around the face. Step 4. Donning goggles. Position goggles over eyes and secure to the head using the ear pieces. Adjust to fit comfortably. Step 5. Donning gloves. Don gloves last. Select correct type and size. Insert hands into gloves. Extend gloves over gown cuffs. Now we will watch a demonstration of the steps and sequence of removal or doffing of PPE. Step 1. Removal of gloves. Grasp the outside near wrist. Peel away from hand, turning glove inside out. Hold opposite gloved hand. Slide an ungloved finger under wrist of the remaining glove. Peel off from the inside, creating a bag for both gloves. Discard. Perform hand hygiene. Step 2. Removal of goggles. Grasp ear or head pieces with ungloved hands. Lift away from face. Place in designated receptacle for reprocessing or disposal. Step 3. Removal of gown. Unfasten ties. Peel gown away from neck and shoulder. Turn the outside contaminated part towards the inside. Fold or roll in a bundle. Discard. Step 4. Removal of an N95 respirator. Lift the bottom elastic over your head first, then lift the top part. discard. Step 5. Perform hand hygiene. We will now show other PPE that might be available in your facility. Donning of a face mask. Place over nose, mouth, and chin. Fit flexible nose piece over the bridge. Secure on head with ties or elastic. Adjust to fit. Donning a face shield. Secure on head with ties or elastic. Adjust to fit. Donning a yellow gown. Select the appropriate type and size. Secure at neck and waist. Now we have seen the proper steps and sequence of donning and doffing of PPE. Let's review some key points. Don PPE before contact with patient, generally before entering the room. Use PPE carefully. Don't spread contamination. Remove and discard carefully, either at the doorway or immediately outside the patient's room. Remove the respirator outside the room after the door has been closed. Immediately perform hand hygiene. Ensure that hand hygiene products are readily available and accessible at the point of use, as in the hand washing sink or alcohol-based hand rub dispensers.